Hi, I'm Dr. Kelly Starrett from the Ready State, and today we are talking about how we think about managing the nasty bummer that is osteoarthritis. So many of us, through the no fault of our own, we'll call it the patina of our lives, have accumulated some trauma to the joint surfaces of our bodies. That might be knees, that might be wrists, could be ankles. And what oftentimes happens is that there's not a lot of good intervention there. Let's say that we are taking care of our nutrition, we're managing sleep, and we're trying to move the best way we can. But oftentimes we have joints that are irritable to loading, and there's nothing we can do about it. We might have imperfect surfaces, and that results in potentially pain and potentially swelling. So short of sort of orthobiologic interventions or joint replacement therapies, oftentimes what we say is, have you met an anti-inflammatory, right? Have you met Celebrex? Have you met Tylenol, ibuprofen, which again is really just trying to tamper down sort of this body's swelling response to loading, and potentially sort of helping us get over some of the pain that results from that swelling. Now, it would be great if we had an opportunity to apply our H-wave to some of these chronic conditions, and it turns out we do. And there's two really good use cases for this. One is that oftentimes when we have OA, we cannot be very excited about loading, but we know we need to load to maintain our bones, to maintain our muscle mass, to keep our connective tissue, or simply I just need to occupy my role in society. I need to be able to walk with my family, and go for a hike, and I know that this knee is going to blow up. So we can use that H-wave with some high frequency before we're into activity. And one of the things that happens is if I already have a painful knee, then I'm worried about kind of going and loading it, I can go ahead and apply that high frequency setting across the joint line, just a pad on either side of the joint of the knee in this situation, and go ahead and dial that thing up until I get a comfortable sort of sensation in that high frequency setting. And I can run that upwards of 45 minutes to an hour. And lo and behold, what I'll experience is that I now feel like I can go load and move. Now, understand that we've bought you some time. The goal of the H-wave is that ultimately it's a movement machine. It's always about facilitating movement or mimicking movement through muscle contraction. So what ends up happening now is I potentially have created a window of opportunity where I can exercise, where I can load, where I can move, or even do my rehab, and now I can do so in a pain-free way. The back half of that, which is typically the case, is that those of us with OA kind of engaged in our activities love to go hard in the paint, and then all of a sudden we end up with some swelling or some joint pain after the fact, post facto. So what we're going to do here is say, hey, I'm not going to panic. I have a strategy. There's nothing I can do to manage and change these joint surfaces immediately, but what I can do is manage how my brain is interpreting that. And all I have to do is hook up that same H-wave. Instead of kind of getting out of pain so I can move, I'm going to move. Maybe I've caused some irritation in this OA specific joint. It's osteoarthritis. And now I'm going to go ahead and put that high frequency across the joint and calm things down. I can sort of interrupt that pain signal, give myself some on-demand pain relief that's going to happen during that high frequency treatment, but also for many hours afterwards. And now I have a manageable sort of plan, an actionable plan, where I can go ahead and continue to load, continue my activities of daily living, continue doing the things I love, and still have a plan to manage that pain after activity. So here's how we love to use the H-wave for these two OA cases.